Welcome to this podcast on the future of healthcare with Chief Business Leader of Philips Precision Diagnosis, Kees Wesdorp, and Chief of Radiology at Vanderbilt University Medical Center, Dr. Reid Omary. Join them to hear about topics ranging from sustainability to innovation. Once you've listened, share your thoughts on how we can shape healthcare together.
Sustainability is not only a flywheel effect for innovation, but also access to equal care. I'm also in my mind thinking about teleradiology in the field where maybe in remote areas there are less experienced sonographers in the case of ultrasound, and all of a sudden there's virtual real-time over-the-shoulder coaching when the sonographer is busy with a patient. And obviously that's also access to care because all of a sudden the expertise in a central hub is available in also remote settings. I do think that as an industry, we can take the opportunity to be more advanced with that and think more when we innovate, how does it drive the sustainability agenda hand in hand with the access to care agenda? Reid, let me ask you another question, which possibly could be a paradox, and that is how we combine this important agenda of sustainability together with the desire to provide access to equal care. Is that a paradox, or do they go hand in hand?
On the surface, it may appear to the uninitiated that it is a paradox, but actually they are a flywheel. The more opportunities we can provide access to care in innovative ways, the more sustainability we can have. And the more sustainability, the more access to care. I'll use an example. So 20 years ago, radiology was really the pioneers in what today is called telehealth or telemedicine. So we got rid of the concept that you had image a patient, produce hard copy film, and have it read at the exact place where it was produced. It became so embedded into our practice that teleradiology in 2021 is radiology. In fact, if we use the term teleradiology, it sounds odd. It's like that just seems who we are. So when we also use that mindset and we expand this into other areas of medicine, now we're seeing the advent of telestroke, teleinfectious disease, teleendocrinology. All of these provide access to care for patients who then don't have to drive or take the bus or the train to go see their clinician. The clinician can actually work from home and doesn't need to travel to a centralized area. We no longer need to build really large facilities to take care of outpatients. We can have fewer on-site clinicians. So it's an example where using technology that is sustainable fundamentally increases the access to care. And I think that's a real opportunity for us to expand on. Kees, I have a question for you as an industry leader. When you think about increasing access to care, how might, for instance, a fleet of MR scanners be controlled or operated with fewer technologists present? Is there a way that you can envision centralizing the control of MRI scanners?
What a terrific question. And the answer is yes, and we have to. We talked about access to equal care. I talked about less experienced sonographers or less experienced technicians. And so to have a hub and spoke model and have a radiology operations command center where centrally we have expertise and those are virtually connected with remote systems or other health system networks such that you can reduce the amount of operator variability, increase the training levels, and reduce the burden on staff. That is definitely the future. But this is an example where the future is here. So these solutions are being offered today, and they're being offered in a vendor-agnostic way. And so this is also where I think the industry is heading. We need to provide vendor-agnostic virtual solutions that are interoperable, such that health systems, which typically operate in a very fragmented way, can connect with each other. And that drives sustainability, that drives access to care, that drives better patient experience, that drives better diagnostic outcomes. So a huge win. Great question. And I think definitely we're very, very committed as industry partners to innovate in that domain.
Thanks for listening, and share your thoughts on the future of healthcare in the comments section.